resident, one of the founders here. He's done a lot for the state of Florida, a very good guy, yes, and really cares about the employees of this company. One of the things that we viewed as very integral to Florida's recovery was obviously we want to get people to work, we want to start letting people live their lives, but we want to make sure that we were continuing to push forward on increased testing. And we've done that. I think if you look now, Florida is close to 1 million test results. I think there's another 40-some thousand today, so we're going to be pretty close to that. It's interesting, if you look at the different states in terms of the number of cases, the state that's right above us in the rankings is Michigan. They've got several thousand more cases, but we've done 400,000 more tests than they've done. And you look right below us, Maryland, they're only like a quarter or 30% of our size. They've got 3,000 fewer cases, but we've done 600,000 more tests than Maryland has done. And so this has been a priority for us, and we think it's really, really important. Over the last 12 days, each day's test results, we've had more test results over the last 12 days than we did in any other 12-day period, but the percent of tests that come back positive for our new cases has ranged between 0.67% and 3.3%. And so that's a good sign. That means 99 to 97% of people who are testing are coming back negative. And there were a time throughout the country where you had half of the test takers were coming back positive. Never in Florida, but in some of the other places. So we're going to continue to do it. But one of the things that we have found as we have set up a lot of drive-through test sites, of course, we did in Palm Beach 2 sites, Broward, Dade, where we had most of the cases, but also in places like Orlando, now Brevard County, Jacksonville, the Florida Panhandle, Sarasota, Bradenton, Fort Myers, Tampa. What we're finding is that we have the capacity to do at least 10,000 tests a day just from the drive-through sites, but yet we typically only have demand for about half that much. And so we've told people, come if you want to get tested. It doesn't matter your age, as long as you're an adult. If you're a kid, you got to have your parents' permission. It doesn't matter even if you have symptoms. Obviously, if you have the coronavirus symptoms, you probably want to get tested. But please come out and get tested. And we haven't been able to get enough demand to fulfill that. So we're going to continue doing the drive-through sites because I think they're important for people. But one of the things that we've now done with Jared Moskowitz's leadership is walk-in sites, particularly in underserved areas. And so we have several here in Southeast Florida, well, a lot here in Southeast Florida, that's been really good for communities that didn't have access, perhaps, to the same amount of medical services as some other parts, particularly counties like this that have, a lot of places that are very affluent. And that's been good, and that's been able to get testing. We've gone testing people in like agriculture industry, some of the workers there, to be able to see cases, and there have been cases there. So we want to keep doing that as well. But we also want to do it as convenient as possible for people. And so I want to thank Home Depot and I want to thank Publix for both agreeing to help us make testing even more accessible. And what we're going to be doing, and we're starting here today, we're going to have 3 testing sites in parking lots at Home Depot and 3 testing sites at parking lots in Publix. So this Home Depot here has now this testing site that is set up. And so if you're shopping and you want to get a test, you have the ability, very easy access. You don't even have to leave the parking lot to be able to do it. So we think that that's important as Florida continues to recover, that it's as accessible and as easy as possible for people. The numbers in terms of what Florida's done with the accessible sites is great. We've done about 200,000 tests just at our drive-through testing sites throughout the course of the epidemic. And the walk-up sites, we've done about 40-some thousand tests for that. So that's good. That's about 250,000 tests, which is very, very significant. In fact, we do more tests. We get more test results back in a single day sometimes than some of these smaller states have done throughout the entire course. But certainly if you go over a week in Florida, that's more than a lot of the states have done, which I think is very, very impressive. So we're going to have Home Depot on board. We're going to have Publix on board. You also have 77 new privately run sites with CVS. You have 9 Walgreens sites, and you have 9 Walmart sites. So as the demand has gone down for our traditional drive-through sites, perhaps as people are shopping, they have the ability now to get tested. But we're not going to take resources away from the primary focus of testing, which has been, for us, our staff and residents of long-term care facilities. The state of Florida, through our National Guard strike teams, we've tested close to 100,000 residents and staff members at long-term care facilities. Of course, Florida has over 4,400 long-term care facilities. By doing that testing, you've been able to identify outbreaks before they've spread wider. You've even been able to have time where just one staff member comes back positive and you can isolate them. So we believe that that's something that's very important to continue to do going forward. I know local leaders like Mayor Kerner, Mayor Singer, they understand the long-term care facilities, the risk that you have in those facilities in particular. And the reason why you have more risk there is, one, because you have more elderly population, mostly have underlying existing health conditions, but then you also have an environment where the virus can spread rapidly, close quarters, you have a lot of contact, and so if you have a staff member introduce it asymptomatic, it can spread quickly. So we've got to keep doing this and do the periodic testing of staff, testing the residents, because that's really the best way that we can help save lives. This puts the risk in perspective in terms of with our long-term care facilities. The state of Florida has had more COVID-related deaths in the age 90 and above bracket than it's had in the age 65 and below bracket. And that is pretty stark. So we've got to continue to do that, and we will. I also want to announce today that, or just remind people, that we need to be preparing for hurricane season. Jared has been working on a lot of different things. Obviously, how you do certain things with evacuations, if we have the virus still prevalent in the community, is something that is going to have to be a big part of that. But we also want individual Floridians to be prepared. So it's great to be here at Home Depot. I know Floridians have been packing Home Depots throughout this mitigation period, but we're officially kicking off the Hurricane Preparedness Tax Holiday, which begins today and extends through Thursday, June 4th. So please take advantage. If you need flashlights, if you need batteries, if you need generators, any other materials through this period, it's all tax-free. And we want people to plan, have a plan for their family, prepare, and hopefully we get spared having major storms hit the state of Florida. But as we know, going through this every year, you've got to be prepared for the storms to come. And if you're prepared, then you'll be able to weather the storm effectively. So I want to thank Home Depot again for having us here. I really appreciate the legislature passing this holiday. Last year, I'm glad I was able to sign it into law. We're going to do that again for next year as well. But if you need those supplies, now is a great time to be able to get it. Let's prepare for the worst, but hope for the best when it comes for hurricane season. I want to invite Jacob to come up with Home Depot. I think he's got something for me, which I appreciate, but then maybe if you want to say a few words.
All right, so first, good afternoon, and thank you all for coming to the Boca Home Depot. And I want to thank the governor for, one, attending this event, and then also growing the support we have in the relationship with the state of Florida and the micro testing sites that he has given us the opportunity to set up. So customary when we have a visitor come to the Home Depot, we deliver an apron that is specific, that was made here at the Boca store. So it represents the state of Florida, but the thing that I want to call out the most is the United States Navy. And so on behalf of the 35,000 Home Depot associates in the 169 locations, we would like to say thank you for your service, sir.
Thank you.
You got it. You got it.
That's great.
All right, so I'm going to talk about just two topics, a little bit of COVID and a little bit of hurricane preparation, and we appreciate the governor's message around prepare now, take advantage of this holiday. We believe it will look a little different this hurricane season than before. So look, I'll start out with just saying just some things that Home Depot has done, and we did it early and proactively that visually you can see in the store. And I'd point out to the plexiglass shields to the left and right, the social distancing markers throughout the store. And then I want to call out the yellow aprons that some of our leaders are wearing. We're known for our orange aprons, but these leaders are wearing aprons called the Social Distancing Captain. And these leaders bring to life all of our COVID processes and programs to make sure our associates and customers can really feel what it's like in our stores and to be safe. And then to talk about the hurricane preparation, look, back in the early 90s, Hurricane Andrew hit South Florida. And as a company, that's when we realized that disaster response had to be one of our priorities. And we take that very seriously. Our wish, our hope is that we will not have a hurricane landfall in 2020. But what we want to make sure is that everyone understands that we are prepared. We put a task force together of experienced hurricane leaders, and then we took what we've learned over the last 3 months with the COVID-19 response and the things that you're seeing throughout the store, and we have a plan. We will be able to serve our customers during the hurricane season with a landfall or without, and we are prepared, and then we ask you to do the same thing. The Home Depot Foundation has pre-fortified our nonprofit organizations with supplies to make sure they can respond as well quickly after a disaster. And as always, we will be here to support our local, state, and federal officials. We've been doing this for the past 3 months by donating masks and donating tens of millions of dollars to local healthcare facilities, hospitals, first responders. And what that looks like in South Florida is $250,000 just here in South Florida. So look, before I hand it over, I would just like to take a moment and thank all of the Home Depot associates, the 35,000 here in the state of Florida, for everything you've done. All right? So with that, I'm going to turn it over to the Florida Emergency Management Director, Jared Moskowitz. Thank you, sir.
Thank you, Governor. Thank you. I want to thank the two mayors behind me for their assistance, and I want to thank Home Depot and Publix for helping us start these micro sites. So as the governor talked about, obviously we've been doing a significant amount of testing here in the state of Florida. Obviously, the first mode of these testings were these major drive-throughs so that we could get a lot of throughput. And then we opened up those walk-ups that the governor talked about because there were communities that didn't have access. And we now have over 16 of those walk-ups all over the state of Florida. We then went into places like Immokalee and Indiantown to make sure that those folks had access to testing. And so we will continue to go wherever we need to into whatever neighborhood doesn't have access to make sure testing is accessible because testing is free. And so the division will continue to do that. One of the things we realized, obviously, is that as we get to reopening, we started to see a decline in people coming to these testing sites. And so as we're getting back to regular life, we want testing to be more accessible, as the governor was talking about. These sites are not meant for people who feel sick. If you feel sick, you have symptoms, we're not asking you to come drive here. We want you to go to the testing sites we've set up. But if you're out shopping, if you're out back in society, and you just want to get a test, you want to know for sure, we want to make it convenient. And that's the whole point of these sites. These are retail sites. And we'll see what kind of data we collect. It'll really give us an idea about people who might be asymptomatic, and that will be interesting. We'll help inform people at the Department of Health. And as far as your workers are here at Home Depot and public, essential businesses, they have access to testing now every couple of days so that you guys can feel secure in what you all are doing. The governor talked about how the 100,000 tests we've done at long-term care facilities. We now are doing 10,000 tests per day at these long-term care facilities. They've been a priority of ours. It's why we were very early on in closing these facilities, looking at the lessons learned in the state of Washington, talking to my counterpart there, talking to the general, of the National Guard out there because, obviously the state of Washington had the first outbreak in the nursing homes, and we will continue to make sure that they are a priority. It's why we're looking at things about helping them with negative pressure rooms and sanitation as well. And so, just last week we opened up 6 new walk-up sites in Opelika, Daytona Beach, North Lauderdale, Miramar, Sarasota, and one right here up the road at FAU. The mobile lab that we have, as far as we still know, we're the only one in the country that has a rapid mobile lab that we've been driving not just to nursing homes, but we'll be using that with the homelessness population because we want to make sure, obviously, that they are getting tested as well. And we will continue to find new and innovative ways as we can drive a lab to a location and get results in 24 hours. The governor has talked about hurricane season. I promise there's nobody who wishes we do not have a hurricane more than myself this year. But we'll be ready. The folks at the Division of Emergency Management are battle tested. You're talking Hermine, Matthew, Irma, Michael, Dorian, and now the pandemic. And so, we'll be ready. We've been at a level 1. It's the first time we've been at a level 1 carrying into hurricane season. And so we've done a lot of hurricane preparation. I've taken our planning cells, separated them out from the COVID-19 day-to-day response to make sure that they're doing hurricane COVID-19 response and the things that they would change. One of the big lessons learned from the pandemic is we have to have a lot of materials on hand. And so we have 10 million masks in reserve for hurricane season. We have 5,000 thermometers, 5 million gloves, 1 million face shields, and we went out and purchased 50 large capacity generators just in case power restoration takes longer than usual. We're working with the CDC, FEMA, and the American Red Cross on shelter standards. We are also really leading the charge on non-congregate sheltering. That's using hotels as potential shelters. So we've compiled a list of 200 hotels that have signed up to do that. We're going to continue to add to that, and we will provide those to the counties because, as the folks know behind me, evacuations and shelters happen at the county level, but we want to make sure that they have the tools available, whether they decide to use those tools, those non-congregate shelters for COVID-positive people only, for seniors only, or people with underlying conditions, or just general use. The folks behind me will make those decisions, but we want to give folks options because the most important thing, in my opinion, going into hurricane season is that if you live in an area and that area is not safe for you with a hurricane approaching, we must make sure that you feel comfortable to leave your house and get out of harm's way. And we got to have that confidence that we're providing a safe place to go. We can reopen everything, but if you don't have the confidence to go back out, you're going to stay. And so we'll continue to make sure that we're mitigating those risks as we go through the remainder of the period that we're dealing with COVID-19, and obviously as we get into hurricane season. We talk about know your zone, know what evacuation zone. We also want you to know your home, especially in the June and July period when maybe our storms are not major hurricanes like the August and September period. And that may be because if your home is safe for that hurricane approaching, sheltering in place may be the best option for you. And the folks, again, behind me will make those decisions. So if you live in a newer structure or newer house that has more up-to-date code and we're not dealing with a major hurricane, perhaps staying in place is the best case scenario for you. We want to make sure you have 7 days of supplies. Now's the time to go do that. Let's not rush to the stores, as we get into a hurricane, with a hurricane approaching. Let's make sure we're being proactive because, as we know, supply chains, because of the pandemic, have been difficult. So right now is the time to do that in an orderly fashion and prepare and get 7 days worth of supplies. As far as the sales tax holiday, you can go and get the full list at floridarevenue.com/disaster prep. floridarevenue.com/disaster prep, so that you can see the full list of supplies that are available tax-free. I want to thank Home Depot again for their partnership, and Governor, thank you. And let me introduce the Mayor, Dave Kerner of Palm Beach County.
Thank you. Thank you. My name is Dave Kerner. I'm currently serving as the Mayor of Palm Beach County. I'd like to take this opportunity. First, Governor, thank you for being here in Palm Beach County. We appreciate your leadership, and I want to talk about that for just a moment, and also to Director Moskowitz. These two individuals and these two leaders have led this state through one of the most challenging chapters of Florida's long history. And while we do have a long road ahead of us, we are well prepared and we're under great leadership and we're well resourced. And this is example A of that. A little while ago, the governor moved the state of Florida into phase 1, and we appreciated the deference that you gave the urban counties in South Florida, Governor, Miami-Dade, Broward, and Palm Beach, by separating us out from the rest of the state, because we do have very particular and special needs with the population that we have down here. And there came a time when, with the backing of my colleagues like Vice Mayor Weinroth and the members of the Board of County Commissioners, that we contacted the governor's office and we said we would like to move into phase 1. We think we're well prepared. We don't want to let you down, and the community doesn't want to let you down. And you took a chance on us, Governor. You trusted us, and I hope now that you're back here in Palm Beach County, several weeks after phase 1 has reopened, that you have as much confidence in our community to do the right thing and to stay safe as we have confidence in you and your leadership, sir. And also, Jacob, thank you for that very incredible gesture, both to the governor and to our community, and for embracing a testing site here at your facility. But your employees, your workers, are heroes as well, and they have reemerged into this new society. I think this is the best case example of what is happening in South Florida, how serious we take social distancing, how seriously we take keeping our vulnerable populations healthy, but also getting back into the economic swing of things. There may be a little less demand for testing right now, but there is an immense demand to get back to financial stability in this county, and through the leadership of the governor and DEM, we've been able to find that balance and keep our constituents safe. So there's nothing that I could say that hasn't been covered by our governor and our director of DEM. It's an honor to have you here again, sir. Thank you for the leadership. And to the community, we're doing a great job. The numbers bear that out. That is the work product of the people that live here and call Palm Beach County home. Continue to stay safe, continue to make Florida proud, and before we know it, this new normal will be something that we've embraced fully and will show great effectiveness in keeping the public safe. Thank you again for having us here today.
Well, good afternoon. I'm Boca Raton Mayor Scott Singer, and I wanted to also thank you, Governor, for your leadership during these very trying times. And thank you, Director Moskowitz. There you are, Director Moskowitz. It's not just your leadership, but your responsiveness of your entire administration, and your staff in particular, DEM, Director Moskowitz, has been a lifeline for some of the needs we've had at our city level. Our city is just one of the many who've reached out and gotten responses when we needed, whether it was for smaller things like small business issues, or a very hyper-specific issue on our intercoastal waterway, or the bigger announcement last week with testing and a new testing facility at FAU. And that's why I'm so glad to be here today, as I was last week, because testing is going to be essential for the health, security, and safety of our communities, our neighborhoods, and to enhance our recovery. So we're grateful for all that you've done, all that you're going to continue to do, and thank you for your kind words and smart words to everyone to be prepared. This has presented a number of challenges at the local, county, and state levels, but we're very grateful for the collaboration we have from our state, from our county, thank you both, and at all levels. People working very hard to keep all of us safe, and thank you, everyone in the audience. I can see the many masks here. Continue to take precautions, continue to prepare for hurricane season, continue to be safe. Thank you again, Governor, for your leadership and all your efforts.
Well, I want to thank the mayors for the collaboration, and really, Palm Beach has been great working with the county, Broward, Miami-Dade. We really believe that you got to collaborate. It's a bottom-up deal, particularly when you have counties that got a lot going on. We understood that what would be right for Northwest Florida may not be the same for Palm Beach, and I think that was the right approach. I'd also just like to point out, Jared mentioned the mobile testing lab that we did, and this is another example of Florida really innovating and leading the way nationally. We set the lab up, as Jared mentioned, it's mostly for long-term care, homeless, things where you really need to be expeditionary. But for the space launch on Wednesday, the White House asked us, could you test everyone who's going to be anywhere near the president? So Jared set it up. They think they did 75 tests of people who were going to be in. The White House physician was so impressed with it, he went in and got the schematics, and asked for the schematics, was taking notes. They're going to recommend that every state do something like we did with outfitting this RV. And so I just think that that's good. And it builds off some of the other things. Recently, I was in Central Florida with Vice President Pence delivering PPE from HHS to a long-term care facility. Well, Jared has been sending stuff to long-term care facilities for months because we understood early on Yeah, the hospitals need it, the healthcare workers need to be protected, but if you give it to the folks at the long-term care facilities and you stop the spread there, that'll prevent more people from ending up in the hospital to begin with. And so as of this point, we've sent over 11 million masks just to long-term care facilities in the state of Florida. Jared's now sending hundreds of thousands of more gowns. We've done 500,000 face shields, over 1 million gloves. We were doing that. I went into the White House and did the brief with the president the one day, and so as we did that, then you started to see FEMA and HHS follow suit because they understood. So I really appreciate the way Florida has really innovated and led the way on some of these important issues, and we are hoping that this launch happens on Saturday. We were all very excited for Wednesday, but these things they made the right decision. But we're on the cusp of, once again, sending American astronauts to space, launching from American soil by an American rocket. And if we're able to do this, the next stop is to the moon again, and then the stop on that is to Mars. And I think the collaboration between the federal government and some of these great new companies is the way to go. And Florida is really going to be at the epicenter for this innovation. And so we really hope that there's a successful launch on Saturday. I know a lot of people were tuning in, so let's keep our fingers crossed. It's going to be a jump ball again, it looks like, with the weather, but hopefully we're able to get it done, and I know a lot of people will be happy. And with that, I'm happy to take a couple questions. I haven't decided yet. Yeah, probably, yeah. I mean, pretty soon. I mean, we've got a bunch of different things that are expiring. We obviously are also going to look at Florida's overall posture on some of the restrictions, and so we'll be having a lot of announcements, I think, over the next few days. So this is interesting because no one was really talking about contact tracing 2-3 months ago. But the county health departments, in conjunction with the Florida Department of Health, have done a lot of contact tracing throughout this whole time period. And if you look at why, so obviously Miami, Broward, and Palm Beach, they had special challenges, partially because of the population being more urban, but it was the #1 landing spot for people leaving New York City, and that's just the fact, and so that makes it tough. They were still, though, during that, doing contact tracing. Now, once the epidemic spreads enough, the contact tracing isn't going to be enough to contain it. But we had a lot of counties in the state of Florida throughout March and April where they were doing contact tracing, and they helped contain. Now, these are not as populous a counties as here, but if you look at places like Panama City, Bay County, some of these others, they had very modest cases, and part of the reason is because you did do that. Now, there are going to be more that are added because we have the ability to do it, but I just want Floridians to know what's going to be done on that is going to be the traditional public health, call contacts, explain to them that they may have been exposed. We are not taking your cell phone data. We are not doing any surveillance. I think that is way overboard. I think that would absolutely be abused, and so we're not going to do that. We are going to do the traditional methods, which have always proven to be effective, and you'll do it. Part of the challenge, though, is this is not like MERS or original SARS, where you would only be contagious once you really started showing symptoms. Here, you have people that get infected that don't even know they're infected. They're people that never develop symptoms, so contact tracing asymptomatic carriers is very difficult. So contact tracing can't do it all. What it can do is when there are discrete outbreaks, be able to have people there, do the public health measures, follow up, and then contain it. And so a place like Palm Beach, you wouldn't be able to contact trace the whole county, but if you had an outbreak in Wellington, then you can go and do it. So there are more added. We got a lot of CARES Act money. That's part of what the Department of Health is doing. But one of the unsung stories about this whole epidemic in Florida was the extent to which the county health departments, in conjunction with the Florida Health Department, did do this shoe leather work. And they did help contain the epidemic throughout the state of Florida from what it otherwise would be. Well, if you look at the unemployment numbers as of the end of April, we were a little over 1 million. We've done a little over 1 million individual claimants, paid out over $3.5 billion. That's more in like the last 8 to 10 weeks than the state paid out cumulatively over the previous 5 years combined. And so you're seeing people get paid. You also have a situation where, obviously the system was, it broke at the beginning of April, end of March. So you actually have people who have now gone back to work who are still getting paid. They're calling saying, hey, I don't think I should get this. And we're telling them, well, actually, you were eligible for these 4 weeks, and so the payment reflects that. So those payments are coming in, and it's just a matter of how it's gotten processed. But I can tell you this, the fact that we have over 1 million is very important, because when this system broke, it was a really difficult situation for a lot of people, and I surged more resources than we've ever done on any domestic issue, I would argue, because I said other than the health, it's our top priority. And so they've been able to do a lot of really good things. So that's going to continue going. And they've been going back and working on, did someone fall through the cracks? Are you making? They've made thousands more calls to try to figure out if someone just needs to tweak the application. So they're being proactive about it. They've worked really hard. We got to continue to do it. Look, this system, I've analogized it to like putting a jalopy on the Daytona 500 track. It just wasn't built for this. And there's obviously an investigation of why the state would have paid so much money for this 4 or 5 years ago. So you're getting under the hood of that, trying to create a really good engine, and they've had some success in doing it. But it requires constant upkeep to be able to do it and process the money for folks. To be announced, yeah. So we're working with Publix and Home Depot. They will announce those. I would imagine you're going to see probably several more in South Florida. Yes, sir. Yes. So we've done it, and in fact, we're working on it as we see fit, as they see fit. We want to host it. I think late August. We're going to be ready to do that, and obviously, his government can tell us what we need to do to make sure it's safe. But I think we should do it. It'll be a huge economic boon for the state, and I think that they're losing patience with North Carolina. And if they don't get answers, that at least the state will work with them, then I think they are looking elsewhere. And of all the states that have put up their hand, and there have been a lot of them that want it, but I think we would be the most natural landing spot for it. So I think you're going to probably get an answer on this within the next, probably the next week, because at some point you got to either pull the trigger or you don't. It's going to take time for people to be able to get in place or whatever. But I think it would be good for Florida. I also think it's good for Florida. If you notice, we may be the home for the Major League Soccer out of Central Florida. May even be the home for the National Basketball Association. I know they're working with Disney. I've made clear we want to have it. We think it's important for the psyche of the state and the country to get sports back online. And so I think that would be great. If you look at the different sports that have happened since the pandemic hit, you have UFC, Ultimate Fighting was done in Jacksonville. We work with Dana White to get them there. WWE has done their Orlando training site to film their things, including WrestleMania. We had 2 charity golf events in the state of Florida, one in Juno Beach in Palm Beach, the other in Hobe Sound, which was on Saturday or Sunday with Tiger Woods. They raised $20 million for COVID relief efforts, and we were happy to have that take place in the state of Florida. And we're also looking to do some racing, some NASCAR very soon. So I think that these are good things, and I'm looking forward to working with folks who want to get back to work. So I think, Jared can probably speak to it. They're looking at doing different things, but I think, as he mentioned, based on the construction of your home, if your home's new and you're in a certain zone, given various risks, it may be better to stay at home, and that'll be something. It's not going to be the state dictating. It's going to be us working with people like Mayor Kerner on our best information, their best information, and then making a call in an intelligent way. We also are obviously preparing, how does this look in the age of the coronavirus? But, may not be as prevalent then. I mean, you actually have people now that are saying, in Oxford, I know they're saying, we don't think we can get a coronavirus vaccine approved by the fall. People say, why? They're like, we don't think in Britain there's going to be enough people that have it in July and August to be able to do the trials. So that, I don't know what they're seeing, but that's what they see it going down. So we'll see what it looks like. But I do think the long-term care facilities, that's very, very important because those are the patients that are going to be most at risk. If you have a situation with coronavirus. So I want to thank Home Depot. This is a really neat thing that they've had there. You've got the beach of Florida, which I think they're open in Palm Beach, right? Your beaches are open. All right, good. You got people out there. You got the oranges, Home Depot, U.S. Navy, and then the Great American Flag. So thanks, Home Depot. Thanks to all the associates at Home Depot for working so hard during this time. And then again, thank my friend Bernie Marcus for always being there for the state of Florida. So thank you, guys.
Step.